Thank you very much, Mr. Speaker. Now, we've talked about a lot of issues in this brief session, but there's been very little discussion about health care, which is consistently the #1 concern for Albertans. Our province has the highest per capita health spending in Canada, but outcomes are in the middle of the pack and wait times are unacceptable. 20% of Albertans do not have a family doctor, and as a result, our emergency rooms are badly overcrowded. To the Premier, we know the only thing that will bend the cost curve of health care over time is consistent access to primary care. Do you support the primary care network model, and if not, what is your plan for primary care?
Honourable Premier.
Well, thank you very much, Mr. Speaker. I mean, it is certainly very true that we need to do a better job ensuring that Albertans have their health care needs met when they need them. And there's a number of different tools at our disposal. We talked in the election about the need to do a better job with respect to long-term care. We talked about ensuring that we didn't willy-nilly drag $1 billion out of the system without ever managing to know where it would come from. We also know, of course, that primary care up front is the best way to manage health care. And so we're going to be meeting with stakeholders to talk about how we can improve outcomes through primary care going forward.
So no answer on PCNs and whether or not you support primary care. More meetings with stakeholders. The Minister of Finance has recently confirmed that half of Alberta's budget goes to wages and benefits, and I want to ensure that our healthcare system is viable and sustainable over the long term. Now, more money isn't always the answer, but better management always is. Again, to the Premier, what specific plans do you have to ensure the management of Alberta Health Services is efficient and effective?
Honourable Premier.
Well, thank you very much, Mr. Speaker. One of the things that we felt that we needed to do in order to improve outcomes in healthcare and to get better care for the amount of money that we are investing in healthcare was to begin by establishing a sense of stability. We have a healthcare system which has been in complete chaos for several years now, and with that chaos comes waste. So stability was the first order of the day. Then I went ahead and appointed a Minister of Health who I have complete faith in, who I know is working day in, day out, hours every day, to work with stakeholders to find ways to ensure that we get better outcomes going forward.
Thank you. Again, not much of an answer. To the Premier, I'll try one more time. Your Environment Minister has taken decisive action on an important and complex file, so there's at least a plan to come up with a plan. But what's taking so long in healthcare?
Minister of Health.
Thank you very much, Mr. Speaker, and thank you to the member for the question. I'm happy to update the Assembly on some of the work we've done. As was mentioned by the Premier, I've been in the job for 4 weeks. I've had the honour of meeting with the AMA as well as a number of other stakeholders, as well as the PCN physician leads, and we're working with them in the months ahead to make sure that that they're being financed in a way that's sustainable, that they're not sitting on $70 million of reserves moving forward, and that Albertans get the best possible care when they need it, where they need it. Thank you, Mr. Speaker.